The fifth Integrated Household Living Survey, EICV5, indicated that Rwandans are still faced with limited access to clean water and sanitation facilities, which cause poor sanitation and related diseases. Moreover, in the initial stage of the COVID-19 outbreak in Rwanda, Rusizi and Nyamasheke districts had relatively high COVID-19 infections due to their high proximity with DRC that was a hotspot for the disease. Nyamagabe had also a significant number of cases due to its proximity to the two districts. It is against that background that SNV, in collaboration with the government of Rwanda through the Ministry of Health, started Wash First project. The project is aimed at fighting against the COVID-19 pandemic and promoting sanitation in Nyamagabe, Rusizi, and Nyamasheke districts. The project activities focused on hygiene and sanitation. It promoted behavior change for COVID-19 prevention and availed sanitation facilities in the three districts. SNV appreciates achievements registered by the project over a relatively shorter period. The main objective of the Wash First project is to support the government of Rwanda COVID-19 response efforts and prevent further spread of COVID-19 in Rusizi, Nyamagabe, and Nyamasheke districts through awareness raising and improved access to wash services to 392,788 of people at households, schools, health centers, and public places. Achievements. Baseline survey on knowledge, attitude, and practices on COVID-19 conducted in 3 districts. Rapid contextual analysis conducted in 3 districts. 17 inclusive hand-washing facilities constructed in 3 districts. 2 comprehensive wash infrastructures constructed in 2 districts, Nyamasheke and Rusizi. 1 menstrual hygiene and health room constructed in Nyamagabe district. Distribution of 60-foot operated hand-washing facilities distributed to 15 selected schools to serve 17,598 school communities, school children, teachers, and administrative staff. Distribution of wash commodities, 75 plastic buckets, 75 brushes, and 75 mops in Rusizi, Nyamasheke, and Nyamagabe districts. Training of 75 community health workers in charge of disease prevention, hygiene, and sanitation on COVID-19 response and hygiene and sanitation promotion. Training of 48 health center and district staff on IPC. Organizing 3 live talk shows on RC Huye and Rusizi. Training of managers on maintenance and repair of wash infrastructures. Airing of COVID-19 spot messages on Radio Huye and Rusizi. Elements for sustainability and how these have been embedded in the project. The wash infrastructures will be managed by the beneficiaries, including maintenance and repairs. The CSWs trained will continue to disseminate the COVID-19 and wash messages, including house-to-house visits if and after the phase-out Wash First project. The mayor of Nyamagabe district is happy with progress registered in hygiene and sanitation, which helped the district in the fight against the COVID-19 and poor sanitation-related diseases.
Maintaining hygiene and sanitation is part of the district performance contracts. In this area, we mainly focus on construction of water infrastructure to ease access to clean water. In our performance contracts of the year ending in June, we had activities related to construction of facilities meant to serve in the fight against COVID-19. Thanks to the support from the project, we constructed 7 washing stations, safe rooms for girls, and more facilities that helped us to achieve our target at a commendable level. Wash First project contribution was significant.
Schools targeted by the project welcomed its contribution in promoting hygiene and sanitation and fighting against COVID-19.
We thank SNV for equipping our school with a safe room for girls, which contributed to increasing hygiene among female students, among all students, and in the school at large. The rate of absenteeism among female students has reduced because they have access to all they need for hygiene. The safe room for girls is very helpful, and through it, our students learn how to use menstrual hygiene materials.
ibyangombwa biba mu cyumba cy'umukobwa.
kuba rero twarabonye ngo rukarabiro rwadufashije cyane.
It is very important that our school has a hand washing station. In the past, we had insufficient mobile hand washing devices. The new hand washing station enables students to wash their hands properly, which is key in the fight against the COVID-19 pandemic.
kubera urwo rukarabiro twahawe.
The school-based girls' safe room improved menstrual hygiene among female students and a safe learning environment for them.
Icyumba cy'abakobwa kitaraza twari dufite ikibazo.
Before the safe room was established, a female student had to interrupt classes if her period surprised her. It was also discomforting for a female student to notice that her colleagues had seen her wearing clothes with period blood stains. It caused too much discomfort. Also, while at school, it was not easy to get new sanitary pads and underwear to change. If you could not afford sanitary pads, you stayed at home during your period because sanitary pads were not available at school. During your period, you have stomach pain and you could not use the classroom to take rest. That was challenging too.
Ntabwo wari kugenda ngo wirirwe wicaye mu ishuri cyangwa wirirwe uryamye ku ntebe, ibyo nabyo byari ikibazo.
In the past, our school had no girls' safe place for menstrual hygiene management. Now that we have a safe room for girls, it is a very pleasing solution to our problems. GS Kibjadira is equipped with a nice girls' room. When using the room during their periods, girls take a rest, get needed care, and can change the sanitary pads. We are also provided with underwear and other clothes when there is need to change. We take a shower as the room is equipped with sanitation materials, including towels, toilets, and anything we need for menstrual hygiene. Wash First Project trained community health workers on the prevention of infectious diseases and promoting hygiene and sanitation. They applauded the acquired skills that helped in improving sanitation in their communities through the construction of proper toilets and observance of COVID-19 prevention measures. The training was timely because community-based hygiene and sanitation clubs were no longer operational. After the training, we reactivated the clubs. Though the number of club members is still low, 31 households from our village are represented in the hygiene and sanitation club. We sensitize citizens on upholding hygiene. All the 202 households in our village have toilets, but only 58 of the toilets are safe to use. But we thank God that we no longer have cases of defecating in the open. Before the training, we did not have enough skills. After the training, we increased sensitization on the importance of owning proper toilets and a facility for drying kitchen utensils. Some people defecated in the open because they had no toilets. We educated them that open defecation pollutes the water that we collect for domestic use. After the training, we were provided with loudspeakers that we use for our message to reach all community members. We visit some of them at their homes and use the loudspeakers to reach to others. We educate them on how to prevent COVID-19. Every local citizen is aware of how COVID-19 affects a human body. They know that they should wear a face mask properly covering mouth and nose. They know that they should wash their hands regularly with soap and clean water. Trainings provided to community health workers and school-based hygiene and sanitation clubs served a catalyst for improved sanitation. More households constructed toilets and adopted hand washing. These are beneficiaries' testimonies on how they were supported in constructing proper toilets and developing a hand washing culture. There was a household inspection to identify those with proper toilets. My family had unfinished and inappropriate toilet. We were informed that the toilet was likely to cause poor sanitation-related diseases. Now I have a proper toilet. That is why you did not see flies all around here despite opposition of domestic animals. We had an inappropriate toilet. When community health workers visited me, they said that our toilet was lacking a lot of things. They engaged Munombe School, which sent its students to help me in constructing a proper toilet. They also made a hand-washing device for me, so after using the toilet, I always wash my hands. In efforts to fight against the spread of COVID-19, Wash First Project set up washing stations near public facilities, including bus parks and markets. The managers of Gasarinda Taxi Park and Kaduha Market described the washing stations as important solutions in the fight against the spread of COVID-19 among users of the facilities.
We welcomed the establishment of this washing station because it contributed a lot in eradicating poor hygiene here. There was a risk for users of this park to get infected with COVID-19 and other infectious diseases because they were touching on things all along their journey. But thanks to the construction of this washing station, that risk reduced. Passengers are washing their hands regularly. We are happy that this washing station was constructed. The washing devices placed in front of business shops were insufficient. This new washing station is nice and always running water. If the piped water is not available, we use water from a tank. There is no hindrance to hand washing.
Wash First Project beneficiaries have suggestions on how the culture of hygiene and sanitation can be adopted by people of all walks of life and serve in the fight against infectious diseases, including the COVID-19.
If the project is extended, I wish we could work together in implementation of the district strategy called the Wash-Wide approach. We seek to increase water infrastructure and water distribution channels, which will help citizens to uphold hygiene and sanitation. We can work together to expand water networks. We want their support in acquiring materials for hygiene and sanitation and increasing the capacity of the washing station. We need another washing station near the entrance, used by pedestrians, because this one is placed near the passenger drop-off point. If we are fortunate to keep the partnership with SNV, we would need their support in equipping our school with more water tanks. We need to increase our school's capacity in harvesting rainwater. We wish their support in constructing separate washing stations near gents and ladies' toilets. Currently, we use traditional hand washing devices placed near the toilets. The only modern washing station that the school uses today is not well equipped and is not covered. Moreover, it is not sufficient.
SNV reacted to the suggestions made by Nyamagabe district officials, school headmasters, and other beneficiaries of the project.
We got suggestions from local officials, community health workers, and other partners. We will forward their suggestions to concerned people, who will in turn engage different organs to get their feedback.
Hygiene and sanitation are key to a healthy life as they prevent hygiene and related diseases. Wash First Project came as a solution in instilling the culture of hygiene and sanitation and preventing infectious diseases, including COVID-19.